All right, I think we're good to go. So thank you again, everyone, for joining today's partner listening session for our insurance carriers. I'm always happy to meet with you all and see some familiar names and also seeing some names here that are a little bit newer to me, so welcome. My name is Amy Coven. If we haven't met, I am the Communications and Public Engagement Analyst with the Oregon Health Insurance Marketplace. And I host these sessions quarterly to provide updates for the state-based marketplace project. So, and to get feedback from you all, of course. So, very happy to have you here today, and I will introduce our guest. I'm going to keep you all on pins and needles for a few minutes, but I will introduce our guest here in just a moment. Before we get started with the actual content of today's listening session, I do want to just remind everyone of the purpose of these sessions, which is to, again, to get feedback from our key partners, which includes our insurance carriers, our community partners who provide application assistance, and of course, you all as insurance agents and brokers. And we're really looking at getting feedback about your experience with using the current system, healthcare.gov. What is working, what could be improved, what you would like to see carried forward, what you would not like to see carried forward. We are really dedicated to partner engagement for the duration of this project. We feel it's very important for us to have our partners not just come along with us for the ride, but actually be involved with the process, especially because you all are really the ones that are using it from day in and day out. So we want to make sure that the system is working for you and working for the clients that you serve. So we do want to set just a couple of kind of ground rules, if you will, to make sure that everyone feels safe to share their thoughts and opinions here today. So we just ask that you stay mentally and physically present, that you contribute to the meeting goals, that we give everyone a chance to participate, that we listen with an open mind, and especially remember that everyone is coming from a different background and different level of experience and different point of view. So we may hear opinions that are different than our own, but we're open to that. So we want to hear it. That's exactly why we're here. Definitely want to stay on point and on time. That hasn't been an issue in the past, but just, for posterity, we have it on there in case we all get super excited and keep talking for a while. And then identify potential action items. So we are more than happy to hear what's not working, what you would like to see improved, but if you have any potential solutions or ideas of how we can do better, we are all ears. We would love to hear that information as well. So definitely would love to hear your ideas on the solutions. All right. Now we'll go ahead and get started with the actual content, which is the fun part. And I'm going to go ahead and start with a project update before we hand it off to our guest speakers today. So as hopefully everybody knows, but if you don't, we have successfully finished phase 1 of our project, which is the planning phase. Yay. We are so excited to be done with phase 1, which really included a lot of project management, a lot of preparation for the next phase. And the bulk of phase 1 was really focused on the procurement of our solution vendor. So phase 1 did end at the beginning of August when we signed our contract with our solution vendor, which is Get Insured. And surprise, they are the ones who are here as guests today. So we are happy to have them, and they will be presenting some information here as well, just in a little bit. We wanted to give you just a list of accomplishments. We've had a lot of tasks that we've completed. This is just a very high level, I would say brief list of what we've done, and I'm not going to read them all here today, but just want to give you an idea of some of the things that we have accomplished, some of the higher ticket items, if you will. Just want to call your name to the last few items here on the list. As I mentioned, we did execute our contract with Get Insured. And then along with finishing or executing that contract, we did receive the Stage Gate 3 endorsement. If you're not familiar with the Stage Gate process, that is a process that is required by all state entities that are going through a major IT project. So we do have a very rigorous and steps that we have to follow and very standardized different gates kind of that we have to go through and that we have to open, so to speak, in order to be able to move on to the next phase of the project. So we have successfully gone through stage gates 1, 2, and 3, which is very exciting. And then we did also complete all of our research and development for our SBM brand name and creative direction. I really appreciate all of the feedback that everyone gave all of our partners, and we had consumer feedback and just a ton of really great feedback that led to the results there. I'm gonna keep you all on pins and needles. You guys are gonna have to wait for a while to see what the final results are. I promise it'll be worth it because it really did turn out fantastic. But we're planning a rollout here, so we gotta do this in a fancy way, okay? Gotta make it look good. And then lastly, just want to give you an overview of our implementation timeline. So now that we've wrapped up phase 1, the planning phase, we've moved into phase 2, which is implementation. And we are working very closely with our vendor Get Insured on phase 2. This again is just kind of a very high level list of all of the tasks that we have to do for the implementation leading up to open enrollment next year. We're 12 months away, and I know Claire's got a specific number. She's got it, so I'm sure she'll share that with us. But leading up to open enrollment next year, and then also for ongoing operations after that. So there's a lot of different things, items that fit within each of these tasks. So these are just high level buckets, but we wanted to share this with you to give you an idea of kind of what's coming. And we'll continue to share this with you to give you an idea of kind of what benchmarks we're hitting and when we're meeting those milestones. So we're just really excited to be, I guess I should speak for myself. I'm really excited to be moving through this process. I know many of you, we've, been in this space together for a long time, and it's been a long time coming. So we're very happy. All right. With all of that being said, I'm so pleased to welcome Claire and Jason here today. They're our guest speakers, and they are here from our solution vendor, Get Insured. We wanted to welcome them today to give you an overview and just a little kind of sneak peek into the product, and then also the timeline. So I'm going to actually hand it off to them, and then after they finish their presentation, we'll have a little bit of time for Q&A and discussion and things like that. So by all means, feel free to ask questions as they arise. You can drop them in the chat, or as always, you can raise your hand, and I can click the button so you can come off mute. So take it away.
Awesome. Thanks so much, Amy, and good afternoon, everybody. Thanks for making time out of your day to join this important listening session. And many thanks to Amy and the Health Insurance Marketplace team for inviting us to participate in this session and in upcoming sessions as we work together both with the marketplace team and you and other partner groups to make this transition for Oregon from the SBM on the federal platform to a full SBM as seamless and effective and pain-free and beneficial as possible, both for y'all and the folks who you serve. So if we could just maybe go to the next slide, please. Thanks, Amy. So I'll talk briefly about sort of our team, how we've organized our team, and Get Insured as a company. Some of you may be familiar with us. Um, so my name, first of all, is Jason Sparks, as you can see on screen, uh, perhaps, or through the interpreter service. I have been leading large scale information technology implementations and transformations for longer than I'd like to admit. But specifically, I've been working around the Affordable Care Act since inception, and spent a number of years working as the chief operating officer at a national nonprofit called Enroll America. Our focus was really all about work that's kind of similar to what y'all do, which is making sure that that consumers are informed, that they know what options are available to them, that they know what they're entitled to, and that they get connected with the help that they need. At Enroll America, we helped connect folks with enrollment professionals in their local communities, and helped educate folks about about the benefits of the Affordable Care Act. From there, I moved on to the DC Health Benefit Exchange, state-based marketplace, where I was the chief information officer for a number of years, and led a number of had the opportunity to lead a number of sort of transformational projects and enhancements, including introducing the just a number of features that were designed specifically, in fact, for the agent community and enrollment professional community. About 4.5 years ago, I had the opportunity to join Get Insured, where I serve now as the vice president of implementation and project management. So I have the privilege of leading the team, cross-functional team across our entire organization, that implements these state-based marketplace projects. And so that's an exciting thing. It's an incredibly, as I know the work that y'all do is incredibly rewarding when we're able to get folks connected with care, being able to do that at scale, and being able to help our state partners, our state clients navigate the process of transitioning from the federal platform to becoming a fully operational state-based marketplace, is very I think very meaningful work, and something that we're excited to do. You'll see a number of folks on our slide. We've listed out sort of our core implementation team. Back behind us, we get to be the face of Get Insured, to folks like you, to the state, to other partners that we work with. But we're backed by a team of hundreds across the company. Engineers, software engineers, developers, quality assurance engineers, customer support engineers, our entire contact center organization, and our really impressive product team that comes up and implements the ideas that come up internally, and also ideas that we hear from partners like yourselves to enhance the platform. And we'll talk about some of those as we continue this conversation. I'm joined today by the wonderful Claire, who I'll allow to invite to introduce herself.
Awesome. Thanks, Jason. Hi, everyone. My name is Claire Houderman, and some of you do look and sound familiar from my days serving as a CMS contractor. I was with CMS for about 10 years, doing all things marketplace. I started on the QHP certification front, making sure insurance companies' plans were up to snuff to be offered on the federal platform, and then moved over into the eligibility and enrollment space to support Medicaid unwinding activities. But throughout my time, I did support agent activities, including the annual training and certification processes. So was one of the faces behind the development of some of those trainings, and so appreciate what you all do and the questions and the energy that you bring, not only to helping your consumers, but also supporting your states and, of course, nationally in achieving coverage for consumers. So thank you, and it's great to be here with you all.
Thanks so much, Claire. The last thing I would just briefly say about our team, who you'll, meet in various ways throughout the coming 12 months, is we all have experience uh, implementing state-based marketplaces. There's nobody on this slide that you're looking at who hasn't been involved in at least one, and most of us, many transitions for states from the federal platform to a state-based marketplace. So, one of the areas that we really focus on is minimizing risk, making sure that we're bringing forward expertise and information and advice to help the state navigate the many potential challenges and risks involved in a transition, so that we can get to a place where we're able to go live for open enrollment for plan year 2027 on November 1st of next year. So, Amy, if I could ask you to go to the next, please. Thank you. And thanks, as always, for driving the slide deck. I know it's not always the most exciting thing to do, but appreciate it. So, again, briefly about Get Insured. Get Insured's been around for, actually, this is our 20th anniversary. 2025 is the 20th anniversary of the company. Prior to the ACA, we did some work in the private health insurance marketplace world, and some of you may have been familiar with us in that sort of formation of the company. But with the Affordable Care Act, we found that we could leverage this software as a service solution that we had developed as the core technology platform to help states make that transition and establish state-based marketplaces. So the first state that transitioned to our platform was Idaho, with Your Health Idaho Exchange. So they've been with us for a dozen open enrollment periods now. Remarkably, their open enrollment started on October 15th. As you may know, they're the state that starts early, which is fun. And then our journey continued with supporting Covered California. We operate the technology platform for MNsure, the Minnesota Exchange. We support and have supported Wabi. In 2017, we were the successful offer for the Nevada HealthLink Exchange and transitioned them. So Nevada was an interesting use case. Actually not entirely dissimilar from Oregon, where Nevada started as a state-based marketplace, transitioned back to the federal platform, and then came back around again in 2017 to establish a state-based marketplace again. And so Nevada uses our technology solution along with our contact center services. And then in 2021, we brought on board, in the midst of the pandemic, two states, both Pennsylvania and New Jersey, who continue to be our clients. In 2023, Virginia joined the Get Insured family. 2024, Georgia Access, state of Georgia, which was the largest state to ever transition from the FFM to a state-based marketplace, with a little bit north of 1.3 million enrollees. And then this year, we've got both New Mexico and Illinois transitioning to our technology and contact center solution. New Mexico is transitioning from an existing software vendor to our solution, and Illinois is transitioning from being a state-based marketplace on the federal platform to operating its own full SBM. So both of those have open enrollment starting in just 2 days' time, along with the other states that you see on this slide, with the exception of Idaho, who started a couple of weeks ago. And now we're super excited to be talking with you about this journey that we're going to be on together with the Oregon Health Insurance Marketplace. So headline here is, a dozen, or excuse me, not a dozen, 10 states leveraging our technology. Um, 6 or 7 of them also leveraging our contact center solution, and really more experience helping states make this transition than anybody else. And so we, as I mentioned before, we really like to try to make sure that we're surfacing that experience, making it available and accessible to all partners in these projects to help navigate what we know is, potentially a challenging, process, particularly with policy changes that are upon us. Awesome. So we can go ahead and jump to the next slide, please. So just briefly, and Claire's going to speak in a moment about the agent and agency specific tools that are available within the Get Insured solution. But our platform, we see it as um, a tightly integrated solution that serves all populations who engage with a state-based marketplace. So that ranges from, our federal partners at CMS and at IRS, our carrier partners, who of course need to receive those enrollment files from the system and send back effectuations. Our enrollment professionals, so assisters, agents, agencies, of course, consumers naturally, and exchange staff and our own staff, Get Insured staff, to be able to provide those maintenance and operations services. So what you see kind of around the border here are each of those entry points for each of those partner or each of those sort of user groups. And when we talk about portals, what we're really talking about is a role-based system that assigns permissions to each user based on the role that's assigned to them. So as an agent, you have the ability to perform certain functions. Again, Claire will dive a little bit more deeply into what those functions are. But you're logging into the same system using the same login URL as a insurance carrier or as me or as Amy. And one of the benefits that we believe this brings is all of those little light blue boxes kind of in the center here are the various key modules in the system. So everything from eligibility estimation to the single streamlined application, plan management, enrollment management, et cetera, is all contained in the same, single system. It all leverages a single database. So what that means for you is, when you need to reach out to our contact center, because you've got a consumer that you're helping that has an enrollment question or an enrollment issue, you're able to see the same information that our contact center staff are able to see. There's no logging into multiple systems. There's no, hicks where you've got to go and log, tickets or anything like that. We're using the same system. We're able to communicate internally within that system using support requests or what we call tickets, so we can engage with each other that way. And we feel that is a useful and a beneficial way to ensure that at the end of the day we're all helping folks get enrolled and stay enrolled in coverage. On the Consumer Assistance Center side, fully staffed by folks who we recruit. We hire aggressively in the states where we operate. Our call center operations are based in our headquarters for call center are based in Atlanta, Georgia, but we've got a fully remote workforce, and we made that transition to a fully remote call center workforce during the pandemic, sort of by virtue of we all know what was happening back then. But what we found uh, that's particularly beneficial with that is that gives us the ability to go local, right? And to go into Oregon communities and find Oregonians who, understand the community, who understand, their neighbors, and are, uh, can be particularly motivated to help folks who call in a way that, a remote call center may not be able to, a nationally run call center may not be able to. So we're excited about that. We do set targets for hiring call center representatives within each state. You'll be able to expect that, and then we also bring some technology along with that. One of the key elements here that I think I would call out for this group of folks, our agent and agency partners, is a dedicated phone line. And so consumers have a phone number that they'll be able to call, toll-free number they'll be able to call to get help. You'll have a phone number that's dedicated to you to get support. So you don't have to go through the same, IVR queue that everybody else goes through. You're able to go to a dedicated line for non-consumers that's tailored to what your needs are, and the calls, importantly, then get routed to uh, a group of contact center representatives who are especially skilled and trained to support agent needs. So we'll talk more about all of these as we continue these conversations. This is we're doing a bit of a early preview and teaser here. Yeah, just wanted to give some insight there into how we think about our solution, and some of the key benefits that we believe it brings. Great. So let's go to the next slide. And Claire, I think I'm gonna, yeah, go ahead and pass it over to you here.
Super. Thanks, Jason. So like Jason noted, we're going to spend a little bit of time just digging in a little bit deeper into some of the features that our agents can anticipate with the new system. Also, just a quick note, this, as Jason said, is just a teaser. We'll be coming back and doing more in-depth demos. So this is really just a high-level look at what you can anticipate. And then, of course, we'll be back to teach you a little bit more about the features we've created. And then, of course, show you how to use them and really leverage them to support your consumers. So we'll talk through four-ish specific features on the next slide, but I think the biggest thing we just want to make sure is clear to you all is the goal of our work, as Jason noted, is to make sure that it's easier for consumers to enroll in coverage, and of course, easier for you all to support them through that eligibility and enrollment process. We'll talk through a couple of features that are a little bit different than what you're experiencing on the FFM right now and what you can anticipate in Oregon. But the goal, again, is to make sure that we're leveraging technology in order to make y'all's lives and consumers' lives easier. Amy, we can head to the next slide. Awesome. So these are just the couple of features that we wanted to highlight today. Starting with taking a look at the contact center supports. And as we noted previously, we have a dedicated line specifically for agents and a separate one for consumers to make sure that you all are getting the necessary information and resources that you need as you support consumers throughout their enrollment journeys, and so that consumers can also contact the contact center and really leverage the support directly. We know Oregon is focused on making sure that folks who speak a variety of different languages all have the same access to the same level of great support. And so we're really excited to be able to offer multilingual frontline consumer phone and chat support features too, to make sure that all of our consumers are receiving the support that they need in a language that is most suitable for them. So that's a great feature, and one, as Jason noted, where the contact center is closely tied with your agent portal to make it easy for all folks to be able to access information and be able to share and provide that support specific to you and your consumers. The next feature that's exciting is the maintenance of the book of business. So we have a self-service portal specifically for our agents that allow you to maintain your books of businesses and specifically allow you to have those designation capabilities within your agency. This is a great feature and one that we're excited to be able to offer you all, since we know this is a key part of making sure that your agency and your agentness itself is organized and able to support your consumers in a way that makes sense for them. The next big feature is being able to streamline that profile creation. So really making sure that your profiles are tailored to reflect your physical presence across the state, including your hours of operations, the communities that you serve. And this is also a great opportunity for you to provide your specific branding or take on your agency to make sure that consumers can see it and can access it if they're looking for those types of services. And then the last feature that I know is really appealing to our marketplace folks too is the built-in reporting capability. So this capability allows the marketplace, but also you and at the agent or agency level to view applications and enrollments by agents and agency, so that you have a better understanding of what your support looks like at any given time in more of a dashboard style reporting feature. This is also great for our marketplace staff who has a little bit more visibility into this based on the data that the FFM gives, but this allows for closer to real-time access so that you can all really see these components and see what your enrollment strategies look like at a given time. What I think is really exciting about the features that we offer is that they are great for supporting an agent with very few consumers, and then also one with multiple agents and thousands of consumers. So this can really be customized and to meet your specific agency or agent needs, which is a really unique and helpful platform in order to be able to make sure that you're able to support your consumers in the best way possible. Are there any questions or anything else folks want to note about the key features? Okay.
Oops, sorry, I was a little slow coming off of mute. Thanks, Claire. No, I think maybe just a couple of things to note. So, I mentioned the team that we've got internally, in within Get Insured that is behind the scenes doing so much work to look at ways to continue to improve the product and the solution that we offer. I think one of the good one very clear example of this is with respect to the agent broker portal, and we'll be doing a demonstration, sort of a live demonstration in a test environment, I think in an upcoming listening session, right? Yep. And so you'll get a chance to see that firsthand. But just over the past year, we've completely redesigned and re-engineered the broker portal. And many of the changes that we've made are a direct result of feedback that we receive from agents and brokers in the states where we're fortunate enough to partner with state-based marketplaces. This includes, to be, very specific, as Claire mentioned, the solution supports, a single agent with 10 clients to a 1,000 agency with 10,000 clients. And as this group is well aware, as you scale the number of folks who you are supporting, it becomes more and more important to get meaningful information, particularly during the very limited open enrollment period. So one of the enhancements that we made as part of this kind of refactor, as we called it, of the agent broker portal is we enhance the way that agents are able to filter to specific uh, groups of clients that you're serving. So an example of that is if you want to see, who are the consumers in my book of business who have data matching inconsistency that expires in the next 30 days. We have a built-in filter where you can just select from a dropdown and you get a list. The list displays on screen. Alternatively, you can export it, but immediately you're able to really, this is designed to help you, I will say, focus your work on priority populations based on where they are in the process. If you've got folks who have submitted an application but haven't completed an enrollment, there's another filter for that because they've already received their eligibility, but for some reason we've not yet gotten them across the finish line and gotten them enrolled into a qualified health plan or qualified dental plan. So that's just one example. And again, we'll dig into the details. But something that I think we'd be really excited about as we're on this journey together during the implementation over the coming year is, as you see these demonstrations, as you have a chance to, experience the agent broker portion of the solution, getting your feedback, right, and getting your ideas, because what we do at Get Insured is we don't just deliver, an existing software solution and say, there you go, that's what you've got for the life of the contract. Rather, what we do is, we go live with the solution that exists, but we invest on a quarterly basis in our roadmap process to bring additional enhancements and improvements into the product. So we're looking to always continually enhance. Alongside that, we've got to make sure we keep the system current from a security standpoint, a privacy standpoint, that the underlying technology that we're using stays current. So, we build all of that, all of those components into our annual roadmap, and then kind of break that out into essentially 4 quarterly releases. And those quarterly releases is where those feature enhancements can also come into play. So definitely do be thinking, please, about, as you experience the product, the product and the solution, where there are pain points, where some of you may have worked with our solution in other states. So kind of hearing where those pain points may have existed. We'd love to get that feedback so that we can take it back to our internal team and find ways to help make the experience better for everybody. Thanks, Claire.
No, thanks, Jason. Super helpful. Great. And then, I see one hand.
Hi there, my name is Lisa. Thanks for taking my questions. So I do have some broker friends in Georgia, and they did not have a great experience this last open enrollment. A lot of system glitches, sometimes it taking 4 to 6 hours, if not more, for them to be able to get an application submitted with a eligibility determination notice and get the person enrolled. So hearing what they went through obviously provides, it's a lot of pain points. So can you speak to, kind of what your organization has learned from that experience and how we may experience a different outcome with our
Absolutely.
transitioning? Thank you.
Thanks very much for the question, Lisa. Georgia was an interesting implementation, and it's a unique implementation. It's a one-of-a-kind state-based marketplace. So Georgia operates not only the Georgia Access portal, which is our driven by our technology solution, where agents can log in directly and submit applications, support their clients, all the things that Claire has spoken about. But in Georgia, we also integrated with and partnered with Enhanced Direct Enrollment, partners, web brokers, as you're likely who you're likely familiar with. And I think, when we think about the challenges and reflect, as we have done at great length on the challenges in Georgia, particularly during the first, to be specific, 17 days of open enrollment last year, the challenges that brokers and agents and others experienced were really focused and isolated within the usage of the enhanced direct enrollment partners. And that is not to place any blame at all on the enhanced direct enrollment partners, because they've been absolutely fabulous, partners along the way with us. It's rather to just highlight the fact that, I think if you were to speak to agents or brokers in any of the other states where we operate, where enhanced direct enrollment interaction is not part of the solution, you would, I would hope, hear different sort of different feedback. So we've done a few things, to part two of your question. We did a few things. So certainly at the initial launch of Georgia Access, again, happy to be transparent and open about this. We had challenges. Some of what you described, with respect to response times and processing times for applications and getting eligibility results for consumers, that were way beyond what we would consider acceptable or desirable. The Georgia Access team, the state-based marketplace team, and again, as I mentioned, the enhanced direct enrollment partners themselves were fabulous in working with us, and we really worked shoulder to shoulder to identify the crux of what was happening with those issues, what was the root cause of those problems. And during that first 2-week period, on a daily basis, in fact, rolled out enhancements, rolled out modifications, changes, configuration updates, infrastructure updates, all of which got us to a place where, by November 17th, we were seeing API response times, application submission times, notice retrieval times, much closer to in line with what we expected. And the balance of the open enrollment period, I think, was pretty strong, as evidenced by the fact that Georgia grew from 1.3 million enrollees to over 1.5 million by the end of the open enrollment period. Beyond that, so that was open enrollment. We took lessons, again, away from that entire experience, and invested time, effort, resources into ensuring that when we entered this upcoming open enrollment period in 2 days, that the system is precisely where it needs to be, that we've worked through the kinks in that very novel, first of its kind integration between a state-based marketplace and EDE partners. And I think we and our exchange partners at Georgia Access, along with our EDE partners, are much better positioned to go into this open enrollment period than last.
Thank you very much. That helps to kind of calm my worries. So I appreciate you taking the time to go through that with us. I do have, if I can, another question, kind of pivoting to the portal and how that will be built for agencies specifically. There's a lot of national talk regarding NPN overrides, and some states are outlawing it. Oregon does allow it. But can you speak to how, as an agency owner, the agency's book of business, I have employed agents within my agency, and so the book of business is shared within the agency, but owned by the agency. So can you talk about how that will work from an agency flow standpoint?
That's an interesting question, Lisa, and maybe one that we want to dig a little bit deeper into with our product team for you. I'm quite knowledgeable about the system, but I'm not the product manager, product owner for this module. So maybe what we might want to do, Claire, is in a upcoming listening session, invite a representative from the product team who can speak more directly to questions like Lisa's. What I can say at a high level is the transition from the FFM to a state-based marketplace, as you may know, involves migrating a lot of data. So we migrate consumer application data, we migrate consumer enrollment data, and within the consumer enrollment data that we receive from healthcare.gov is the NPN associated with an enrollment if there is an NPN associated with the enrollment. So if the NPN is a GA NPN or an agency level identifier, we would pick that up in the migration. If it's an individual, at the agent level NPN, as we would generally see, we would pick that up in the migration. The other data set that we receive will be from Oregon, with respect to agents. And what we'll expect to receive from the state is a detailed listing that is aligned. We've got a template that the state team will populate, the exchange team will populate, that includes demographic level information for agents. And then we work together with the exchange team, with agents and with agencies to make sure that if you've got 100 agents within your agency, that those agents are associated with your agency. And what we're able to do with that then is kind of bring all of these data sources that I've just mentioned together, so that when we go through the data migration process in September of next year, we are linking the consumer application and enrollment that's associated with a given NPN with the NPN that aligns with Lisa, for example. So that's a super high level, and what that does is, just to kind of carry the story to its end state, what that does is allows your both you as an agency manager and the agents who work for you within your agency to claim their accounts when we send out activation notices that have a unique claim code, so you're able to log in at that point to your account. And it also allows us to automatically build your book of business for you, so you don't have to go off and sort of recreate. If you've got a large book of business, you don't have to go back and seek consumer consent and have them come in and designate you again. We build all of that for each agent and each agency automatically through the process. Now, when it comes to a shared book of business, again, that's I don't want to get too far over my skis on this one and misstate anything. So if you're okay with it, Lisa, we could either take it back and follow up, maybe Amy in post call Q&A, or we can, as I suggested, have someone from our product team go ahead and join and be able to speak directly to that question. But I hope some of that, Lisa, at least is helpful as in terms of how we conceptualize the data migration and the linking of consumer data with agent data.
Yeah, it is very helpful. Thank you for that. Yeah, we can take that back, and I look forward to talking with somebody when they can join from the product team. So thank you.
Perfect. You bet. Thank you. Thanks for the questions.
Jason, I have a question for you.
Yes, sir.
My name is Stephen Thill. I've been doing health insurance since basically the process started way back during Cover Oregon debacle, and then through the health insurance marketplace. And I use Health Sherpa. Are you guys going to basically integrate with Health Sherpa, or what's going to go on?
So it's a great question, Stephen. So this is, I think directly related to the discussion that Lisa and I were just having. So, Health Sherpa is one of those enhanced direct enrollment partners, web brokers, right? And the only state currently, the only state-based marketplace that integrates with those web brokers or enhanced direct enrollment partners is Georgia currently. And Amy, I don't know if you want to sort of weigh in here as well. For go live for plan year 2027, there will not be an integration with the health Sherpas of the world. So agents will use the agent solution that we've been briefly talking about here today, and that we'll demo for you in a future listening session. And Amy, anything else you'd want to add there?
No, that sums it up pretty perfectly. I just wanted to say that the team did a really thorough analysis on the options that are available, and evaluated the different, when we were going through the RFP process and the evaluation process, really took a look at what each vendor was able to offer. And obviously now that we have a vendor, seeing what they were able to offer for our agents, and to determine what was the best solution. And so at this time, we are planning on not integrating that EDE support, but we always are going to be looking at innovations and updates in the future. So who knows what will happen in the future, but at least at rollout, we won't be having that live yet.
And we know, thanks, Amy. And I think, Stephen, the last thing I'd just, super quickly try to add is, we know from our discussions, across the country with agents that many agents do utilize Health Sherpa, other ED partners, other third-party, entities to help manage their book of business. One of the features that we do offer to try to help bridge the gap when a state-based marketplace is not integrating with ED with enhanced direct enrollment partners is we give the ability to directly export your entire book. So if you're using an external tool to help manage your book, you can continue to use that. Any updates to enrollments, any changes to applications, et cetera, would be done through the Oregon Health Insurance Marketplace platform that we operate. But in terms of tracking, reporting, things like that, you still have that flexibility because of that ability to export your book.
Well, I hope you're integrating some of the stuff that Health Sherpa does, because it's so user-friendly from an agent standpoint compared to the insurance marketplace right now. It's a nightmare and a half if you go through the health insurance marketplace, and Health Sherpa has basically allowed me to get through and help my clients more time, basically a lot easier, and the process is seamless. And if you go through healthcare.gov, my clients are just like, what's your username and password? And they basically are like, I don't know what it is. So anyway.
Yeah, totally understand. And some of those features, and this is why, one of the reasons why we've, put so much time and energy into the agent and agency portion of the system, is because we know how challenging that can be, and how much time that can take away from the important work that y'all do. And so I think that Claire touched on this briefly, but within our solution, so on the new Oregon Health Insurance Marketplace, you'll have your own dedicated login where you can manage your book of business. And by manage your book of business, I mean go in, look at an individual client, look up Jason Spark, see what my eligibility is, see what my plan is, see what my APTC is. If you need to report a change, you'll have full ability to act on what we call act on the consumer's behalf. So you see what the consumer would be able to see. You can make those changes on behalf of the consumer. Obviously, I'm talking about individuals who have designated you as their AOR, right? But for that population, you're able to just log directly into the Oregon Health Insurance Marketplace portal and make those changes directly. So, the concept of a three-way call would only come into play if there wasn't a designation, right? If the consumer that you're trying to work on behalf of hadn't designated you to be their AOR. And again, all of this is functionality that we're happy and excited to demonstrate to this group and any other agents and
Obviously, we've got a
agencies
long
who have.
time to go in the
Yep.
big scheme of things, but my biggest question is integrating your client base into this new system. How seamless is it going to be? Because the last thing in the world I want to do is basically herd cats. I want my clients basically clients again.
Absolutely. And one of our top priorities, Stephen, and for the team in these transitions is, and you'll hear us talk about, making things as seamless as possible. We do that with the state Medicaid agency, and we do that with the data migration process. So again, just to very briefly recap what I was saying earlier about data migration, we take that work on for you, so you don't have to go out and outreach all of your consumers, outreach your book, and have them redesignate you. If they are designated to you in the data that we get from the from healthcare.gov, then when we go through that data migration process, they're automatically going to be linked to you, and you will see them in your book of business when you log in for the first time in the portal. And if you don't, if there's some gap, if there's some data that's missing in the FFM data, or if there's any issue in the data migration process itself, we have functionality in the agent portal that allows you to search for, well, two things. One, allows the consumer to proactively find local help, search for you, and redesignate you. That's one option. But in terms of taking that effort away, taking that work away from the client, you will have the ability to search for that client, locate them in the system, generate a one-time passcode to them, and they can redesignate themselves to you. So we've again spent a lot of time looking at what options are out there and looking at what those pain points are and working to streamline that. So what you should expect is at your first login that you're going to see that book of business.
Awesome. Thank you very much.
You're welcome. Thanks for the questions.
Thanks, Jason. Thanks, everyone. I think then just to make sure we can cover when we're going to do all this exciting work, Amy, I may have you go to the next slide. And if you want to go one more too, we're going to give just a really quick high-level overview of when we're going to do all of this work. And I think just to start us off, we have worked on this type of timeline, this year timeline, in many other implementations, and feel confident that we'll be able to deliver this platform and product for you all. I'll go over some of the key features, and I know Jason was able to touch on with Lisa and Stephen's questions, the data migration component, but we know there's other aspects of this transition that are important to you all. But in 367 days, Amy was right, I know the count, we will be going live with Oregon, and we're so excited for that. So the first big feature and step in our process, as Amy noted really early on, is to make sure that the platform and the CAC is configured correctly. This is exactly where we're at right now with Oregon and starting on those intense conversations to make sure we're understanding Oregon's requirements and that we're working to meet those requirements in a way that makes sense to the Oregon population. So we'll spend a good chunk of time here over the next several months, making sure we've got it right and have worked out all of those kinks through various stages of testing. This is also where we're working with CMS to make sure we've received approval from from them to go live. And so this requires us doing a gap analysis of our application versus the single streamlined application that the FFM currently uses to make sure that consumers aren't losing any of the functionality and really the questions that are answered or asked there, to make sure we're pulling that over into our system. But that's really where we're going to spend a bulk of our time. The next big phase of where we'll bring agents in is during that training period. So next summer in particular, but as Jason noted, we'll come back a variety of times just to make sure we're gaining your insight, getting your perspective, and making sure we're thinking through how to best build that into the system. But we have a dedicated time slot in August of next year through really the start of open enrollment, making sure that our agents are ready to go, that they understand and are able to access the agent portal, have an understanding of what consumers are also going to experience so that you can help them along the way. But this is where we'll spend that bulk of the time after we've set up the platform and the CIC as a whole. Then those next big phases is really where we hit into the agent data migration components. And I know we spent some time here, but this is one of the biggest features, especially for agents, in making sure that we're getting the data from CMS and from Oregon correctly so that your consumers are assigned and designated to you, and so that your books of business are there starting day one. This is where we'll spend a lot of time making sure that we have that right data, and we'll work with you all to make sure that it looks correct too. And I know Jason hit on those couple features that do exist if there is some sort of mismatch in the system, and we need to make some updates in order for you all to have access to the consumers that you currently have access to. The next big phase then is the soft launch. So this is right before open enrollment and will be targeted for the October-ish timeframe. This is where we'll test out the platform without allowing consumers to make those enrollments. So there will be certain features that are still turned off. Obviously, consumers won't be able to shop for plans at this stage, but they can begin to claim their accounts, and agents will be able to claim their books of businesses prior to open enrollment so that you're ready to go starting November 1st. And that's really, I also kind of hit on the agents receiving access to the platform. That's what we're looking for in that time period, is making sure you all have the books of business that you're expecting and that you're able to see your consumers. We'll then head into the open enrollment period, and this is really where we, of course, are seeing most of our activity on the platform. So this is consumers coming in, they're shopping, they are using the Find Local Help feature to make sure that they can request additional support if needed. They are working with you all to make sure that they can understand the process they need to complete in order to be enrolled or to stay enrolled. So this is really go time for you all and also for our consumers and the other wonderful stakeholders that we'll work with, right? So important for our carriers, our assisters, and of course the call center, making sure that they are adequately staffed and ready to go to support during this time. I think the last big thing we'll note is we know that this is just the beginning, right? So ongoing operations will continue after open enrollment. And as Jason noted, this is what we've planned for year one. There are many years to come. And so we're excited to see and work alongside Amy and other friends from Oregon to make sure that we're adapting the system in order to meet your growing needs and wants, in order to be able to make sure consumers gain access to coverage. But this is just a snapshot of what the next year will hold. And we're excited to be able to partner and continue to really discuss with you all ways to make sure that this is a meaningful experience, not only for consumers, but also for you all. Great. And I think, Amy, I think that's our last slide for, at least for this session.
Yes, sorry, I was trying to find my mute button there. So yes, thank you, Claire and Jason, for all of that great information. It it's helpful to have, I think, that background and just that high level overview. So, and I know that there's a lot more information to come in the coming months. So as promised, we did want to leave some extra space to get some additional feedback from you all. I've put some discussion questions or prompts up on the screen. These don't necessarily have to be the questions that you answer, but these are just to kind of get your brain thinking about, what types of communication or engagement would be most helpful as we continue to move through each phase of implementation. How much lead time do you need to prepare your teams for system changes and new functionality? And are there specific times of year or operational cycles that we should avoid when planning, testing, or training activities? I think we all know open enrollment's included there, but I think we'll be good with avoiding that time. So I do want to just leave the floor open a little bit to get some feedback. And let's see here. So we do have a question, Claire. This may be something that we can tag team together, or maybe Jason can help with. We have a question that if this is really launching for us at the start of open enrollment 2026, so I think you mean in 2026, so that would be for the 2027 plan year. What kind of agent support is going to be in place to ensure things go smoothly? Many of us have back-to-back calls with clients and only 30 minutes to complete renewals. If the platform shuts down, what workflows are in place to ensure timely support? That was a long question, but I don't know if you or Jason have some overview information that you could provide.
Yeah, absolutely. I'd be happy to. I mean, I'm sorry, could you walk through it again? I caught some, but I was trying to make notes as well.
Yeah, no problem. So it looks like there's two questions. So the first is, what kind of agent support is going to be in place to make sure that things go smoothly for the launch? And then the second point is, this agent is pointing out that they have back-to-back calls with clients and only 30 minutes to complete renewals. So if the platform shuts down, what workflows are in place to ensure timely support?
Yeah, good. So I think great questions, and very much appreciate the opportunity to speak to both of these. In terms of agent support, so we think about agent support as not just one thing, but there's a suite of sort of services that we will, as the vendor, provide, and that will work together with Amy and the Oregon Health Insurance Marketplace team to ensure we provide. So I think one key learning for us in handling multiple of these implementations is agents need to be familiar with the platform. And the more familiar agents are with the platform, the more comfortable and confident that agents are navigating in the platform, the greater success agents will have in utilizing the platform. It seems pretty basic, right, and pretty fundamental, but it's something that I think has really resonated, at least for me, over the past 3 implementations that I've led, where we've taken some specific actions to increase the amount of training materials, for example, that we develop in partnership with our state-based marketplace clients, to make sure that there are a range of training materials from sort of quick hit short videos about how do I access my book of business, how do I use some of those functions that I was talking about in terms of filtering, to longer training sessions, to recorded training sessions that are available in a learning management system, to even sort of live working sessions that we've done in a couple of states as well, particularly with certain agent communities. So we want to start from a place of, I think the high level, or the headline really is, we want to start from a place of making sure that you understand how the system works, how it's supposed to work, so that if you experience issues, you're able to have a baseline understanding that this is not working the way that it should work, and that'll help accelerate the ability for our team to resolve. But it doesn't just start and end with training. It also extends to technology and it extends to people. So, we talked briefly about the Consumer Assistance Center, the call center that we provide. Um, in our experience, having a phone line that you're able to call that's staffed by customer support representatives who are specifically skilled on and informed about the work that you do. Many of them, have been agents or have, may still be agents, but have a background, in that world, and can put themselves in your shoes more quickly than, sort of an entry level, customer support representative. So making sure that we're routing those calls, that you've got access to that phone number, that we're routing those calls to the right folks, that we're doing the work that we need to do during the implementation to make sure that those contact center representatives are up to speed, and able to support you from day one. And then the third, I think probably the third leg of this is what I alluded to earlier when I was talking about the kind of the integrated solution, the fact that this isn't just a website and a website over here and a call center over here. It's an integrated solution. One of the key benefits to that, again, is the fact that we're all looking at the same data. So you will have the ability as an agent to click a button and create a service request, a support request, what we call a ticket. A ticket's a work item. The tickets are, so we use our own sort of custom built CRM solution for support request and ticket management that allows us to tailor the way that we route those support requests or tickets to the right people. So just the same way that we've got folks answering the phone who understand your business and understand the work that you do. When you log a ticket saying, I've submitted this application and I'm getting a Medicaid eligibility result, but based on the information in the application, this really seems to be like, seems to me that they should be getting QHP with APTC and CSR or APTC alone or what have you, right? That's information that because you've been doing this for so long and you understand the ACA, right? And you understand eligibility. So you don't have to just pick up the phone and call a 1-800 number to get support with that. Rather, you can go to that consumer account and you can submit that support request on the consumer's behalf. The ticket is going to get routed again to specially skilled folks in our contact center who will review the ticket. They'll dig in, they'll pull up the application. We all, I think, know that there are some common ways that you could end up with a Medicaid eligibility result, even though you expect QHP or APTC. And these CSRs, these customer support representatives, are trained on what to look for, how to scan that application, how to look at the inputs in the application and see maybe one question was answered wrong. Maybe they're not getting APTC because they attested that they didn't reconcile taxes. That's the system is working as designed, but if the consumer or the agent is moving quickly and maybe just answered the question in a way that they didn't intend to, when the application's submitted, the system's going to do what systems do and give a result based on the way it's programmed, right? So, I think those are the three, places that I would initially state that we look to aim to provide support through robust training materials, through well-trained and knowledgeable workforce in the contact center, and then also leveraging technology, making technology available to you to be able to communicate back and forth with our contact center staff through those support tickets. So, you can move on. Stephen mentioned, he's got a limited amount of time you got back-to-back client calls, right? And you don't have time to call a contact center, but you do have 30 seconds to submit a support request and then move on to your next appointment, right? So that's what we aim to do.
And
Go ahead. I'm
Jason,
sorry.
really quick, just to kind of piggyback off of that, since we're talking about calling into the contact center, we have another question about whether agents will be provided any sort of reference number or contact, like name or anything when they call into the contact center. Is there any sort of standard protocol like that for the other contact centers that are ran?
I'm just looking at the question. Will agents be provided any reference number or representative full name? So again, there are a couple of ways this works, and I apologize for going. I hope not too far into the weeds, but I know this is a community that's deeply invested and interested in the work and making sure that this works well. So please indulge me for a moment. So as an agent who is certified in to sell on Oregon's health insurance marketplace. You're licensed, you're certified, you completed your trainings, we've created your account, we've migrated the data, we've built your book of business. We have your phone number on record. So when you call the contact center, one of the first things that our contact center system, telephony system does is it looks at the phone number that you're calling from, and it looks to see if we have that phone number, if we recognize that phone number. So say, we see that phone number and we realize that that's Amy. We're going to immediately in the interactive voice, in the interactive virtual assistant portion of the phone system, before you even needed to talk to a customer support representative, we're going to authenticate you. And we're going to ask for essentially 3 pieces of information that are unique to you that something like your NPN, and a couple other data elements, which we'll nail down as we work with the marketplace team. And again, we're gonna make that attempt to authenticate you in that interactive virtual agent. So by the time you get to a CSR, and I was looking at our average speed to answer earlier today, and it's depending on the state and depending on the time of year, it runs in the 2-second to 15-second range, speed to answer from the time you authenticate, for example. When your call goes to the customer support representative, the customer support representative gets a screen message on their monitor that indicates to them whether you've successfully authenticated or not. If you've already authenticated, we're just going to verify your name, and we're off and running. And we're able to support you at that point. Same holds true for consumers who call in directly. We try to get the authentication done automatically. We inform the customer support representative that you've successfully authenticated, and then we can jump right in, again, to whatever the issue is that you've got. Now, if you're calling on behalf of a consumer, we're going to go through another level of identity verification because we want to make sure that we ensure that the consumer is designated to your account. So we're going to ask you for a couple of pieces of information with respect to the client that you're calling about, and we're able then just within the system to see that you are in fact designated to that consumer, and then immediately you'll be able to do whatever you need to do to support that consumer, report a change enrollment, what have you. Want to look back at the question, see if we answered it there.
Yeah,
Oh,
I
I
think
see.
Terry,
So,
I think
mhm,
that to your just to jump in really quick, I think that to your question, I think those are more operational questions that we have yet to kind of figure out. I'm definitely going to make note that that's something that I think that that's good feedback, that that's something that you would like to see. So I'll definitely make note so that
yeah,
once we're developing all of those policies and procedures, that we can consider that feedback and determine what the best course of action is for that policy and procedure. I think that we're so early in the process so far that we're just barely starting implementation. So we haven't quite nailed down all of those. To Jason's point, we haven't quite nailed down all of those steps quite yet. So,
yeah.
but I
Thanks.
really appreciate that feedback. Yeah,
Yeah,
no,
no, it's
absolutely.
great feedback, and thanks, Amy. And I think the only thing I would quickly say, just being cognizant of the time that we've got, is um, so both internally, so Get Insured has a training process that's well established. We hire folks and then we train them, and we train them for weeks. They go through an ACA 101. They go through specific, Oregon specific policy training, and then they sit alongside in shadow mode. They sit alongside experienced customer support representatives, listening to calls, listening to how experienced and well trained customer support
Oh,
representatives handle calls. Um, all of that happens before they are allowed to take live calls. Once they begin taking live calls, we have a quality assurance team that listens in on calls, that spot checks calls, and then we've also got some technology behind the scenes that allows us to get visibility into what's being discussed on calls. Um, Along the same lines, we work with our state-based marketplace clients to bring together our quality assurance activities to make sure that folks are getting the right information. And then when in the event that somebody gives an incorrect answer, we're going to recoach them. We're going to pull them off the phones. We're going to coach them. We're going to retrain them. They're going to go through whatever learning management class they need to go back through to make sure that they're at the place where they need to be. And then Stephen had a question about process to get consent from clients. Again, in the data that we get from healthcare.gov, we inherit that consent. So we don't need to go back out. The state-based marketplace does not need to go back out and re-secure consent. If the NPN is associated with the consumer, then it is assumed that that is a relationship that exists as between the consumer and the agent, and that will carry forward to Oregon's health insurance marketplace. Of course, at any point, a consumer can opt to de-designate, to change agents, but from a transition standpoint, a migration standpoint, there's no sort of re-verification of consent from a system standpoint. Now, we all know that the exchange has is entitled to request from agents documentation about consent, as it deems appropriate, but from a system standpoint, we don't go back through and do that.
Great. Thank you so much, Jason and Claire. We really appreciate all of the information. We are just about at the end of our time together, so I just want to kind of wrap things up here today. Again, we really appreciate everyone taking time out of your busy schedules, especially so close to the beginning of Marketplace open enrollment. And I know many of you are already amidst Medicare open enrollment. So thank you so much for being here today. Just as a couple of reminders, if you think of any questions after this meeting, you are welcome to email them to us or submit them on a quick form that we have on our website, and we will get back to you as soon as possible. We also do send out quarterly newsletters, so feel free to sign up for those if you have not received one yet. We have one going out in the next week or two. And then on our project website, we've got tons of reports and project documents and all sorts of things. So definitely encourage you to take a look there. That does stay very up to date as well. But in the meantime, we have covered, I think, all of the content here today. So really appreciate, again, everyone joining here. I know that it's a busy, busy time of year, but I hope everyone has a safe Halloween if you celebrate that, and happy rest of your day.
Thanks so much, everybody.